in the middle of all of this discussion on health care and health insurance, let us not forget a few basic points. 60 million Americans do not have access to a doctor. We need a revolution in primary health care. We need to make sure that we have the physicians, the nurses, and the dentists who are going to get out in underserved areas. Senate bill provides authorization. The House bill provides a trust fund for community health centers and for disease prevention in general. And my strong, strong hope, and I'm going to do everything I can to make sure that it happens, is that the Senate adopts the House provisions. So, Mr. President, if we are serious about providing health care to all Americans, we've got to expand community health centers, got to make sure there are primary health care doctors, dentists, nurses out there. In addition, we need to focus on disease prevention, and I know my colleague from Iowa has worked very, very hard on that. So we've got to support the trust fund in that area. I would yield to my friend from Iowa.
First, I want to thank the senator from Vermont. There's no one who has been leading the charge longer and stronger and more fervently for our community health centers than the senator from Vermont, Senator Sanders. I just want to thank him for that. You know, obviously, we all have community health centers in our states. In Iowa, they've been a godsend for so many people in rural areas that did not have access to these kind of facilities. I remember one time I was in Fort Dodge several years ago, and they had a small free clinic there that was in a church basement one night a week for people who could come in that didn't have insurance, couldn't get access to a doctor. They had one old dental chair there. I think every couple of weeks a dentist would come in for people. A woman had come in and had tried, she had an abscessed tooth that was hurting her so much she took a hammer and a screwdriver and tried to knock her tooth out. Of course, then she damaged her gums. That's how desperate people get. Well, it was because of that, I got the Fort Dodge community looking at a community health center. They now have a wonderful community health center. They have doctors there, they have nurses there, and people have access to that kind of dental care and health care.
Let me just mention to my friend, in the state of Vermont, the poorest region of our state borders on Canada. It's called the Northeast Kingdom, the northeastern part of the state. For 30 years, we have had a number of community health centers in that region. And you know what? Amidst all of the poverty, all of the unemployment, all of the economic problems, we do not have a problem in terms of primary health care in the poorest area of the state of Vermont, precisely because of these community health centers, which you indicate addresses dental care, which we often forget about, mental health counseling we forget about, low-cost prescription drugs. So I look forward to working with the chairman of the Health Committee and others to make sure that we fund the kind of revolution we need in disease prevention, in primary health care, which at the end of the day improves people's health, keeps them out of the emergency room, keeps them out of the hospital, saves us money. Study after study saves us money.
I can't help, I thank the senator again, I can't help, but every time we talk about community health centers, I always have to add one thing. A lot of people think community health centers are just for poor people who don't have anything. Nothing could be farther from the truth. They will take anyone who walks in the door. You can have health insurance, you can be on Medicare, you can be on Medicaid, you can have no insurance, you can have a great insurance plan, whoever walks in the door, and they have a sliding scale based on income, based on resources of who they will take. It's been my experience, I'd ask the senator from Vermont what it's been in his area, but it's been my experience in our growing number of community health centers in my state of Iowa, that more and more people
Consent for 2 minutes more.
Without objection.
With insurance are coming to community health centers. Why? Because they get the kind of hands-on care, they get the kind of supportive services, a lot of times language barriers that are a problem. They get preventative care. They get all the things that make people feel better about their own quality of health care. So more and more we're finding people that actually have health insurance going to community health centers. I ask if that's been the experience.
Let me concur with my friend from Iowa. In the state of Vermont, we have gone from 2 to 8 with 40 satellites. Over 100,000 people in Vermont are now accessing community health centers for their primary health care. And the other point that we don't often make about community health centers, they're democratically run. They're run by the communities themselves. And my experience is exactly what the senator from Iowa's experience is. They are community health centers. In rural areas, it's not rich or poor. By and large, most of the people, regardless of income, go in there. The doctors are there for a long time. The dentists are there. It is, in fact, in the best sense of the word, a community health center, open and accessed by all people. People take responsibility for it because it's democratically run. It is a program. It is one of the bright, shining stars of public health in America. And I would hope to work with the chairman of the Health Committee to make sure that these programs are funded adequately in this bill, that we adopt the language in the House, which goes a long way. I would yield to my friend.
I can assure my friend from Vermont that this senator will be in the forefront of fighting for the maximum possible support, money, and input for our community health centers that we can possibly get out of this bill. I can assure him of that.
Okay. I thank the senator very much. And yield the floor.
The senator from Wyoming.
Mr. President, I would yield myself as much time as I might need out of the remaining time that we have. And I, too, would like to thank the senator from Vermont for his passionate comments on community health centers. In Wyoming, we have community health centers, and they serve a great role. And for underserved areas across the nation, they are absolutely critical. I wish that there were more that we were doing in the area of community health centers.